Using a Volk lens is a great way to assess the fundus. It provides many advantages over traditional direct ophthalmoscopy. These include a stereoscopic view, a wider field of view. Particularly pertinent at the moment, patients will find it much better as a practitioner is out of their personal space. Magnification is also relatively independent of ametropia and can be altered with lens choice, and you get better views generally through media opacities. The technique for using a Volk lens is fairly straightforward. In some cases you may need to dilate the pupils, however, once practiced it is fairly easy to see the fundus even with an undilated pupil. It is worth noting when you're learning to use a Volk lens, if you can practice on younger patients who have large pupils, this is a good way to get used to it. Firstly, ensure the patient is comfortable on the chin rest and aligned with the cancel marks. Dimming the room lights. The illumination system should be aligned with the viewing system. Set the magnification to low and use a parallelepiped beam of low intensity, moderate height and moderate width. Ask the patient to fixate on your ear or a fixation point straight ahead. Line up the beam with the pupil and place the lens in the path of the beam about 7 to 10 mm from the cornea. Hold the lens in your left hand to examine the right and vice versa. The hand can be steadied by resting your little finger against the forehead rest, and your elbow also can be placed on the lens case if need be. Pull the slit lamp back until a red reflex is seen, and then further back to focus. The optic disc should be in the approximate area of focus if the patient is fixating on your ear. First, examine the optic nerve head, altering the position of the lens, the beam and magnification if required. A top tip is it can be handy with the reflections you may see to tilt the Volk lens slightly to reduce these reflections. Moving the slit lamp from left to right or right to left, depending on which eye you're looking at, will allow you to look at the disc, moving to the macula and back. Then you'll want to look at other parts of the peripheral retina. Remember that the image you see is inverted and laterally reversed, so the inferior view is the superior fundus. To view the superior fundus, get the patient to look up, like you would with the direct, remembering the image again is inverted and laterally reversed. If you're learning and you're at all confused, draw what you see and then literally turn the paper around 180 degrees and that will be the actual image. There are some great videos on YouTube and you'll see a link at the end. As with any technique, it will feel strange at first, but my last top tip is practice, practice, practice. Before you know it, you'll be a Volk advocate.